Everybody, it's Dr. Sam Robbins. I'm going to talk about the 10 big mistakes people make when measuring their blood pressure. And I talk about blood pressure because most people have high blood pressure and don't even know it. This includes my mom a few years ago, and even me when I was under times a lot of stress, and I realized I had high blood pressure. And again, I didn't think so. And most people, again, don't know they have it, and that's why blood pressure, high blood pressure, hypertension is called the silent killer. I've even consulted really healthy athletes, and they've had high blood pressure. And again, you would never think so. They eat well, this and that, because a lot of things can contribute to high blood pressure. High blood pressure can obviously cause a heart attack or stroke. High blood pressure can make you feel tired. High blood pressure also negatively affects your kidneys. This is a big problem because the kidneys don't regenerate like the liver does, and the kidneys also get weaker as we get older. Also, your blood pressure tends to go higher and higher as you get older, no matter how perfect your diet, no matter how perfect your exercise plan. So you want to improve your blood pressure at any age, especially over you're over the age of 35 or 40, just to reduce the inevitable problems of having high blood pressure and weaker kidneys. And this is why, again, like I said, you can't tell if you have high blood pressure. And that's why I suggest everyone take a blood pressure measurement at home. All right. You don't have to go to the doctor or any of that stuff. And taking it at home will actually be better. Unfortunately, like I said earlier, most people don't do it correctly. So they get wrong numbers, sometimes high numbers. And then you're like, oh no, I'm freaking out. I got high blood pressure, and you don't, because you're just not measuring it correctly. Also, a lot of times you go to the doctor and they measure it incorrectly, or because you're running there or you're under stress, or it's called, the white coat syndrome, and you have high blood pressure. And the doctor's like, hey man, you got high blood pressure. We're going to give you a drug for hypertension, and you don't need it. So the good news is that, again, you can take, blood pressure readings at home. I've got one here. I'll show you how to do it in a minute. And, you can just automatically do it at home. You don't have to use the stethoscope like they did in the old days, nor do you have to buy expensive machines like they may have at the doctor's office. However, I put also links below this video in the description area on popular videos on how to improve and have lower healthy blood pressure levels naturally without drugs, and whether it's diet, lifestyle, or specific vitamins and supplements and minerals that you can take. So make sure at the end of this video you scroll down in the description area and take a look at those important videos. But all right, so let's quickly talk about the different mistakes you make or people have made, including myself, when you're doing blood pressure testing at home. And also, I'll give you the link to the blood pressure cuff that I use, and I got it in Amazon. There's a few good ones. Some of them aren't so good because I've tested them, and the reading's totally off compared to the more expensive, better ones that are tested. So let's get started. So one of the first problems is that people use the wrong arm. You should always be using your left arm. I've gone to the doctor, and they've just tested my right arm at times. I'm like, oh, I didn't say anything. I'm like, whatever, because I had good blood pressure. But you always want to do the left arm. Number two, you don't want to do it over clothes. Okay, so you want to just move this up and make sure your sleeve isn't ever in the way, and just do it directly on the arm, no clothes, nothing like that. Now, the next mistake people have made, and again, I've made it in the past, is they put it in a wrong position on their arm. So I'll quickly see if I can show this to you. First of all, you have the tube right there, right? And you put it in. Right about there. And you want to leave about an inch to the elbow, right? If you can bend it. So want to make sure you're there. And it'll tell you right here, there's a little marking over here. You probably can't see it. That goes right to the vein right here. So, but you normally have the tube right down the middle, and you want about an inch above the elbow, right? So that's the first thing. You want to make sure the position is right, and which I just described. Now, the next problem is sometimes it's how tight or loose. When I used to do it, I used to make it super tight, right? Because I thought it's like a workout thing. And I've had people just, like my mom, does it really loose because she doesn't want anything too tight against her skin. You want it just enough tight so you can put one finger in there, You can't, if you can put like a lot, three or four, that's not it. If you can't even put one finger in there, it's going to be, if you can't even put one, then it's too tight. More than three or four, it's too loose, then it's too loose. So you want to make it so it's one finger. Now, the next problem that it's people make, and I've seen it at the doctor's office, and I used to make, is they leave the arm hanging down and they test it that way. Okay, you don't want to leave it hanging down. You want the area to be right where the heart is, right? So normally I just would leave it, like, obviously you can't keep it up, but you can leave it like on a desk, right? Sometimes at if you do those cuff readings at some, like the pharmacy, they'll have it in the right position. So you want it slightly elevated, right? So it's right where your heart is, and you don't want it hanging down. You obviously don't want it hanging it up. So just want to keep it right where the heart is. So keep it slightly elevated. You can put it on a table or maybe a couple pillows underneath your arm. So that keeps it right in line with the heart. Now, the next problem, and I've made this also, is where your feet are. If it's just dangling off like the table, sometimes you have it at the doctor's office, that's not optimal. If you have your legs crossed, that's a definite no-no. Ideally, you want to be sitting upright, the arm is there, and then your feet, you want it, both of them planted straight down on the ground, okay? So you don't cross them, don't have them dangling up, anything like that. You want to just sit up natural with your arm down. Keep your feet straight, both of them on the ground. Now, the next problem is not resting enough when taking your blood pressure. Me, I would like come down and, I've got this on near my sofa, right? I'm watching TV. I'd like go get a glass of water or whatever it is. I come, I sit down, immediately I take my blood pressure, right? Now, again, luckily I have really good blood pressure. I always have. I eat well. I take my blood pressure optimizer supplement, so I'm good. However, you can't do that. Normal people, regular people can't. You need to be resting for at least 5 to 10 minutes. So sit down, relax, all right? No talking. Don't do it right after you ate. Don't do it if you're stressed out, because all those things elevate your blood pressure, elevate your heart rate, okay? That fight or flight, stress hormones, cortisol goes up. So all of that will negatively affect your blood pressure and give you an incorrect reading. Remember, blood pressure being high is good when you're needed for survival. You're going upstairs, you want your blood pressure to go up because that gets you going. In the morning, your blood pressure goes higher because it wants to wake you up. So you don't want super low blood pressure, which is the problem with medication can do. Obviously, you don't want high blood pressure all the time, especially when you're just super relaxed for 15 minutes. You're sitting there. That's the best time. You're not talking. You're not eating. You're relaxed, and you take the blood pressure. That's the optimal time. And if your blood pressure is high, then now we've got a problem, especially if you've done all the things I mentioned. It's in the correct position, your feet are down, and all that stuff like that. Now, another problem is that will give you false or incorrect, inaccurate readings is if you have a full bladder, like you needed to urinate, if you're holding it in, that will naturally increase your blood pressure, okay? I remember I had surgery once and my blood pressure was really high and the doctor said, oh, he just needs to go urinate. And, I went, I urinated, and then blood pressure went perfect. So keep that in mind. If you're holding back urination, you got to go pee, get it out, because if you have to hold down that pee, if you're holding it in, if your bladder is full, that will slightly or sometimes a lot increase your blood pressure. Also, stress or taking stimulants, that's another problem. Again, like I said, if you're running up the stairs, you're stressed, that'll increase your adrenaline, and that's a stimulant. Now, if you are drinking a lot of coffee, if you're someone who takes like these pre-workout drinks or constantly taking, these drinks that give you a lot of caffeine in there, sometimes they give you stimulants, other kind, all of that will artificially increase your blood pressure. Now, of course, if you're drinking coffee all the time, every day, and that's just your life, then that's fine. I'm not telling you to go off of it and then test it. But if you just happen to have if you didn't sleep well the night before and you got up, you're like, man, I need to go take some espresso, and then you do your blood pressure, you're like, oh, wow, why is it so high? That's a problem. Some people take these pre-workout drinks that have a lot of stimulants, and then they do their blood pressure. It's not the optimal time, so keep that in mind. Lastly, another problem is just testing it once and assuming that's the right number. So, for example, again, you go to the doctor, you're under stress, you've just been running around, you have the white coat syndrome, you're a little bit nervous, you have a little anxiety. Who knows what happens at the doctor's office? It's never a good reason you're going to the doctor's office, it's always bad news. So, you do the blood pressure there, and it's like high. And they're like, that's it, it's a problem. But you want to take multiple tests, okay? So, when you're at home, again, you did all the things that I mentioned, the previous 9 things. Do the test. You wait 5 to 10 minutes. You do your test, see what the reading is. Wait another 5 minutes and do the test again and see what your levels are. If they match, perfect. And then another time is you take it in the morning, you take it in the afternoon, and sometimes you take it at night. Over the course of a week, you'll get an idea of what your blood pressure is at rest throughout the day. That's the important number. But expect at times it's going to be a little bit higher. Typically, it's a little bit higher during the day, and it's normal. Blood pressure and stress levels go up in the morning to wake you up, and that's cool. Blood pressure and stress levels should come down at night so you can get to sleep. Now, blood pressure and stress and adrenaline and all that stuff is up at night. That's a problem because blood pressure is going to be unfortunately high at a time that it shouldn't be high. In regards to blood pressure machines and cuffs and so forth, the accuracy you have to keep in mind. This one I have is the Home EdX one. I'll give you a link to the one on Amazon. It works pretty well. I've tried other ones. They weren't as accurate. It's not that expensive. I think it was like $30 or $40. I don't remember. I'll have the link. It's a good one, so it's more accurate. Again, you just put it in and that's that. The other ones, they have wrist cuffs. And that's actually the original one that I got because I'm like, I don't want to put this on my arm all the time. Just put it on my wrist. That one is super inaccurate. And when I did it, my blood pressure was always awesome. It was like 110/70. Sometimes it'd be low. I'm like, wow, man, I'm really healthy. And speaking of, the ideal blood pressure should be like, quote unquote, 120/80. All right, systolic over diastolic. But if it's lower, it's actually better. And so keep that in mind. Lower is typically better as long as you're not having symptoms, or you're like fainting, or you have low energy or any of that stuff. But lower, if you can have lower blood pressure naturally, that's actually really good. Because again, it's all the capillaries and veins and blood vessels and all that extra pressure over 10, 20, 30, 40, 50, 60 years starts to cause erosion and causes more stress to your kidneys, your brain, and heart, and so forth. So the lower, the better. And with those wrist ones, mine was always super slow. Super low. So I was like super awesome, happy, great. Then I read that they're not accurate. So I went and got the arm cuff one, and lo and behold, it was higher. It was still normal, but one thing to keep in mind is for whatever reason, and I've spoken to a lot of different doctors, when you do these, the top systolic number is always a little higher than it should be, not the bottom diastolic number. So for example, mine is typically like, for example, it's like 130/80. I'm like, why is that top number always high? And I read research, I asked different doctors, and I always say, yeah, these ones are gonna always be a little bit higher on that top number. Versus if you did it the old school method with the stethoscope that the nurse does it, puts the bottom of the stethoscope right at the heart, at the vein on your arm and does the pumping and all that kind of stuff. That's the most accurate. But you have to have someone who's knowledgeable on how to do that. Most of us don't. Most of us don't have the knowledge. We're not doctors. We don't have nurses with us. So we'd use one of these methods. And so just expect if that top number is a little bit higher, don't freak out. Obviously, if it's like 140, or 150, that's a problem. But up to 130, it's okay. And ideally, like mine is typically like at night, it's like 115/70. Okay, so technically, if I did it with the manual one, it would be even lower, like 110. So keep that in mind. Healthy blood pressure is super important. Most people have it, high blood pressure, don't even know it. And you can start monitoring how you're feeling, different times, this and that. Obviously, look, after a workout, expect your blood pressure to be high. That's good. But a few hours after the workout, blood pressure goes way lower. So it goes high, then it gets way lower. And that's the way it should be. Again, keep your blood pressure and kidneys healthy. Underneath this video in the description area, I've listed the most popular videos on how to improve your blood pressure naturally, so you don't have to take medications, because those medications, there's like dozens and dozens of blood pressure medications, and they all have side effects. For guys, it's a lot of sexual problems, so keep that in mind. And they can cause hair loss and different things for different people, so we don't want that. Always try to do it naturally, so you don't have to be a slave to taking medication, harmful drugs that can be toxic. So do it naturally, including you can take specific herbs and vitamins and minerals, and that will help improve blood pressure naturally, especially as you get older, over the age of 40 and 50. I know my mom's blood pressure started going higher for no reason as she got over like the age of 70. So I increased her supplements some more, and her blood pressure is now back to normal. So it's a part of life. At least now you know what to do and how to do it naturally. So please, no excuses. Take action. Get a cuff. I put all the information below in the description area underneath this video. Take action. Blood pressure is super important, all right? It affects everything: your mood, your energy, your heart, your brain, your kidneys, your organs, everything. And it's something, in some ways, even maybe more important than cholesterol levels, but they're all interactive together. So if your cholesterol's high, sometimes blood pressure's high, cholesterol's high, blood sugar affects it. So they're all interrelated. This is one thing you have control over because you have it at home, all right? You don't have to take blood sugar readings like you do if you're worried about diabetes. You can just do this at home. You don't have to prick a finger or anything. If this helps, let me know. Put your questions and comments below. Subscribe if you aren't. Thanks for watching. Wishing you a happy and healthy day.